Dear Apoorva Mandrilli, I am writing about your article, The Pivotal Decision That Led to a Resurgence of Polio, published in the New York Times on September 7th, 2024, detailing the switch from trivalent oral polio vaccine, OPV, to bivalent OPV. Yes, the removal of type 2 from OPV was a significant mistake by the World Health Organization, Centers for Disease Control and Prevention, the Gates Foundation, the Rotary, and the Global Poliovirus Eradication Initiative. The architects of this plan not only relied on computer modeling to make their flawed decision, they unfortunately were not acquainted with an event that occurred in Belarus in the 1960s, when the Soviets stopped administering OPV. Within 3 years, there were outbreaks of paralytic poliomyelitis in Belarus. Sequencing of the collected isolates revealed that severe disease resulted from infection with Sabin type 2 recombinants. The story was told by Kostya Chumakov in This Week in Virology episode The Chumakoviridae, number 1024 in July 2023. The critical mistake that has led to the resurgence of polio today was the change of focus of the eradication campaign from the disease to the virus. More than 99% of poliovirus infections are asymptomatic. These patients, as well as those who develop paralytic disease, shed infectious virus in their stool. Therefore, unlike smallpox, in which asymptomatic individuals did not play a role in virus transmission, the majority of poliovirus transmission is a consequence of asymptomatic infections. Consequently, tracking cases of paralytic disease is not the same as monitoring virus circulation. Furthermore, you state in the article that NOPV2, the novel oral poliovirus type 2 vaccine, is more effective at preventing and stopping outbreaks than the vaccine based upon the Sabin type 2 strains. This statement is incorrect. Recent studies in Nigeria that used NOPV2 to stop an outbreak demonstrated that NOPV2 is no more effective or efficient in prevention or outbreak control than the vaccine based upon the Sabin type 2 strain. Additionally, the number of cases of vaccine-associated paralytic polio due to NOPV2 administration is roughly the same as that of Sabin type 2. The difference between NOPV2 and Sabin type 2 is negligible, and consequently, administration of NOPV2 is unethical, as I stated during the NOPV2-focused TWIV 1041 in September of 2023, and in my most recent discussion on polio eradication here on YouTube. This sentiment was also published by my colleagues Stanley Plotkin and Kostya Chumakov in Science magazine in a letter published December 2023 entitled Polio Eradication Efforts, Above All, Do No Harm. The oral poliovirus vaccine based upon the Sabin strains of poliovirus were delicensed in the United States in 2000, and NOPV2 will never be licensed in this country. The correct and ethical action now is to abandon NOPV and switch to IPV, which has been done in many countries, including the United States. Though I greatly appreciated you bringing the switch failure to the public, you failed to recognize other important aspects of the eradication campaign, which include stoppage of poliovirus research. The suspension of poliovirus research not only creates a more dangerous world, but is based upon a misguided conclusion that poliovirus has been removed from the environment. As you point out in your article, since 2016, there have been over 3,000 confirmed cases of paralytic poliomyelitis, suggesting that hundreds of thousands of individuals are infected, a far greater threat than any laboratory stock.